Welcome to this important conversation co-hosted by Jhpiego and UICC. My name is Somesh Kumar and I work as the Senior Director in the Technical Leadership Office of Jhpiego, Baltimore, US. Well, most of you would be aware. For the few who are not, Jhpiego is an affiliate of Johns Hopkins University, and we have been working in more than 45 years in various domains of women's health and infectious diseases in more than 150 countries, with more than 3,000 public health experts across more than 30 countries. Jhpiego partners with national and subnational governments for building the capacity of health systems to implement evidence-based and innovative interventions to prevent needless deaths of women and their families. Specific to today's conversation, Jhpiego has been a leader in the area of cervical cancer prevention for many decades now, and we have partnered with more than 40 countries to introduce cervical cancer prevention services in these countries. Jhpiego, under its new strategy for women's cancers control, intends to take an ecosystem approach to women's cancer, which includes strategies aimed at health systems, capacity building, as well as market shaping to expand access to key technologies and products where they are needed the most. To this end, today's conversation is timely as we are standing at a pivotal moment in the history of cervical cancer prevention, where for the first time, we have the goalpost for our efforts, that of cervical cancer elimination. While this may seem to be a too long-term a goal, we have very clear short-term milestones of 90, 70, 90 by the year 2030, towards which we can align our efforts for. However, to get to these efforts by 2030, we need to rapidly expand equitable access to innovative tools and products for cervical cancer prevention and treatment in low and middle income countries. And I'm very much looking forward to hearing from our panelists on their vision and strategies for the same.
Good evening and welcome to the session, Accelerating Equitable Access to Innovative Technologies for Cervical Cancer Elimination, a collective effort across sectors. What an honor for me to challenge each one of us to seriously consider how we can innovatively drive and accelerate the progress towards cervical cancer elimination collectively and equitably. For the first time in the history of mankind, we have the tools, the armamentarium to eliminate a cancer. And while there have been setbacks as a result of COVID, the time has come for us to up our game towards the elimination of cervical cancer as set by the World Health Organization strategy. For 90% of our 15-year-old girls to be vaccinated with the HPV vaccine, for 70% of our women to be screened twice in their lifetime with a high-performance test, and most importantly, for 90% of those with abnormal screens to be treated with the appropriate treatment. To achieve these 90, 70, 90 goals set by WHO, effective collaborations and approaches are required. Today, we have a panel that reflects the complementary partnerships that can bring to fruition what is within the reach of women globally. While technology and innovations can facilitate health outcomes, there is also a real risk of widening the gaps of inequity. For this session, we have 4 distinguished speakers from diverse backgrounds, but a shared vision for cervical cancer elimination. Let's take a dive and ask ourselves honestly how this can be done equitably. To kick off this session, we have the privilege to have Joanna Sickler, the Head of Healthcare Systems Policy from Roche Diagnostics. Over to you, Joanna.
Thank you so much, Yinling. And we really thank you and appreciate the opportunity to be a part of this conversation to be able to share some of our approaches to be able to expand access to cervical cancer programs globally. In addition to being able to share our current approach, one of the key aspects of what we want to be able to do is to co-create with groups like partners on this panel. And so it's also a privilege to be able to hear from them as well, so we can continue to think about how we can evolve and improve the work that we're doing. So to kick us off, Yin-Ling gave a great overview of the WHO elimination targets. For us, these provide not only a vision, but also the building blocks of how we want to think about strengthening health systems to build cervical cancer programs. At Roche Diagnostics, what we think about is how we can bring our skills, our experiences, and our solutions to contribute to this effort. Taking a step back, I think one of the key things is that we're a diagnostics company. So obviously we start in the lab, but one of the things we recognize is that is not enough in our contributions to this effort. Just providing tests doesn't mean anything if it's not part of a meaningful program that's providing women access. So as a result, looking at this slide, you'll see that the lab is just one of the 6 areas that I'm going to touch on where we contribute and participate. So starting on the left, we definitely do work related to providing materials to support outreach to get women into clinics for screening. We also provide training in many cases for primary healthcare providers so that they're able to provide screening services. Sample collection is a really important part of this process that I think is recognized by those of us in the community, but is not always thought about outside of it. And the innovation of self-sampling is really expanding women's access by providing an option that can be done in their homes in many different places, and also that many women are fundamentally more comfortable with. We do work in the lab, and within the lab, we are focused on efficiency, strengthening of the lab, as well as training of the laboratory personnel. But the other piece of our approach is that there's no point in implementing screening if once women are screened, they cannot be linked to the appropriate services to get the care that they need. So we also oftentimes are participating in specialist training. We are providing a full portfolio after the screening of diagnostic tests so that they're able to also be triaged and diagnosed. And we are also starting to get into looking into digital solutions for linkages to care and disease management. Because again, there's not value in doing a test in a lab if that result isn't getting back to a woman with a provider who's able to initiate the next steps. The other thing I want to highlight about our overall approach is that as an organization, we are very proud of our science. We've executed 3 landmark studies for cervical cancer globally that have enrolled over 80,000 women. And we continue to bring this scientific approach as we work to expand access to programs globally. So that means doing research in the settings, in the context where these women are, looking at, does this digital app actually work? Does it connect women? Does it do the things it needs to do? Are our solutions performing in the same way in different settings in Africa and Latin America as they have in the US and EU? And that continues to be a very important part of what we do. And partnering with scientists in these settings to enable that is a key part of our work. So getting into how we work, I mentioned in the beginning the importance of co-creation. We don't have one way we do things where we come into a country and just say, this is sort of the Roche offering. What we really want to do is sit down with the appropriate partners and stakeholders and understand what we can bring to the table to contribute to the programs. Some examples of how we've done that: in Mozambique, we worked with the Ministry of Health, the US government, as well as the implementing partners to be part of the conversations from the beginning about how we deliver cervical cancer screening. We're very proud of the Go Further public-private partnership with PEPFAR, the Bush Institute, UNAIDS, and Merck to work towards 95% elimination of cervical cancer in 12 African countries. And in Latin America, we've also worked with ministries of health and helping them think about how they actually shape their tenders to ensure that it's not just testing, but also the appropriate outreach services. Because we have a global footprint and we work in so many countries, we are often able to bring ideas to the table that have worked elsewhere to contribute to the conversation. And lastly, coming back to our science, we're always very excited to partner with researchers. We are very honored to be part of Project Rose with Professor Wu to be able to provide tests as part of our investigator-initiated study program. Lastly, I really emphasized how our approach extends beyond the lab, but I don't want to end without saying something about the lab, because that is very much at the core of what we do as well. And so we really think about the importance of lab system strengthening as a part of healthcare system strengthening. We're all familiar with the challenges of vertical program building in these settings focused on a specific disease area. And what we really see is an opportunity to contribute to lab strengthening that will benefit HPV, but can also benefit a range of areas. And so our COBOS systems don't just do HPV screening. They do a wide range of other tests. And what that means practically is in some contexts, we're able to come into a lab that already has the systems installed, that already has the lab staff trained, and we're able to just add the HPV testing capability. In other cases, we're able to come in, install instruments, and train staff in order to do HPV, but that is actually setting a platform for other types of testing later as healthcare system needs evolve. And so that's a very important part, is this multi-disease testing approach and how we think about developing our solutions to be strengthening lab systems overall, to be prepared for what's needed today, but as well as tomorrow to serve public health. I'd like to thank you very much again for the opportunity to participate in this very important discussion. And with that, I will pass it back to Yinling.
Thank you very much, Joanna. It's been a pleasure to collaborate with Roche on Program Rose as well. Thank you. It is now my pleasure to introduce to you Robert Matiro, the Director of Programs from Unit 8. Over to you, Robert.
Thank you, Yinling, and thank you for having Unit 8 on this important panel. I look forward to just sharing with you some of the perspectives and important work that Unit 8 has been investing in alongside several partners to accelerate access to innovative screening and preventive therapy for accelerating us towards the goal of eliminating cervical cancer. Unit 8 is a development financing agency that invests in new ways to treat, prevent critical diseases, including cervical cancer. And I'll share with you some of the important perspectives on the work we've been doing in the last 3 years and where we want to hope, working with several partners, to get to in this elimination strategy. This is just a summary of some of the critical areas that Unit 8 is focusing on with its investments. Specifically, we're supporting the introduction of innovative tools to screen and then treat precancerous lesions for women living in low resource settings. Our current investments are roughly $60 million that we're investing through to 2022 and cover a wide set of countries in low income and low middle income settings. What you can see here is the scope of those investments across 14 countries, particularly in sub-Saharan Africa, but also in Latin America, as well as Asia. We are targeting our investments. Unit 8 works with partners on the ground who work hand in hand with governments and civil society and industry. And the partners that we're working with presently are the Clinton Health Access Initiative, Expertise France, Jhpiego, the UICC, and the World Health Organization. There are 5 key areas of work that we're investing in and partnering on. The first is critically about generating evidence on the benefits, harms, and cost effectiveness of different screening and treatment tools and algorithms. This is really important so that we know what are the most effective evidence-based approaches across the continuum of access to screen and treat precancerous cervical cancer in women. The second area is about service delivery. And what are the most effective and innovative models for screening and linking to care? And how can we adapt these to country contexts? Because contexts vary from country to country and geography to geography, and therefore it's really important to see which models are most suited for the most effective outcome. Thirdly, community engagement and demand generation for cervical cancer screening and treatment are really important. We may overcome certain barriers around cost and effectiveness, but we need to really have communities, civil society on board to ensure there's sufficient awareness of the solutions available and how we can roll them out. The fourth area is around advocacy, health financing, health systems preparedness for screening and treatment. And that's a critical area to ensure that we can scale whatever solutions are brought to reach the widest number of eligible women possible. And then lastly, and this is crucial to the work that Unitaid does broadly, as well as in the cervical cancer space, there's market shaping. And this really hinges on affordability and ensuring that we have tools that are the right cost and can be cost effectively used to sustain the supply over the long term and at scale. Just to highlight on some of the key targets and achievements that we're looking at. So far, in the last couple of years, Unitaid and Jhpiego in particular have realized some important milestones, particularly when it comes to HPV testing and thermal ablation precancerous treatment. We've managed to reduce the price of HPC testing on PCR platforms by roughly 30%, which is an important achievement in getting us to more affordable, scalable solutions for HPV screening on PCR platforms. And we've managed to reduce the cost of thermal ablation devices by roughly 50%. And these devices are showing that they can be substantially more cost effective than the tools that have been available up to now for treating precancerous lesions, in fact, 10 times lower when we look at cryotherapy. Of course, we need to be ambitious and aspirational, and we're also working on investing in studies that could potentially bring AI or artificial intelligence-based screening tools on standard smartphones to help us get to a place whereby test and treat would cost no more than $1. That's aspirational. We're not there yet. There's a lot of work that still has to be done, but we're really committed to driving towards that type of game-changing screening technology alongside the other tools that we have today. Lastly, our investments are generating evidence on efficacy, cost effectiveness, and operational feasibility, as well as the impact of the innovations that we're bringing for secondary prevention. And also, we need to also support the logistical aspects of rolling out these technologies, such as for forecasting alongside these efforts. Moving forward, there's some important considerations that we need to be aware of and focus on so that the market for screening and prevention technologies is stabilized and grows. The first is, critically, we need to make sure the response is sustainable, and that's the response of multilateral, bilateral funders, the response of governments, the response of partners globally, regionally, and on the ground. And that means we need to think about local solutions, how we can integrate across diseases and sectors. And we saw in the earlier presentation an example of integration when it comes to testing platforms. And there's also opportunities for working within existing systems as well, so that we're leveraging systems and building on those systems rather than creating new and parallel systems. The centered approach on people is really important. So people-centered and human-centered approaches will be critical to making these solutions appropriate for the different contexts in different countries. Secondly, and this is a real gap that has to be addressed moving forward, how do we develop sustainable and expanded health financing for cervical cancer? There's major financing vehicles and partnerships in place for other major disease areas, but we don't yet have this for the cervical cancer response. And so that will be really critical if we really are going to realize the strategy of eliminating cervical cancer. And lastly, on the demand side, we have to ensure that more vulnerable women are aware of the importance of getting screened. More governments are aware that there are solutions and approaches and policies that can enable that. So the demand side work is really critical, because even if we resolve the supply side by getting more affordable, quality, game-changing tools, as well as for preventive therapy, we need there to be demand for those tools and opportunities for the beneficiaries in particular to understand that these can really change their lives and what they can contribute to their communities and their families and their countries at large. So these are critical communication considerations I wanted to leave us with by way of conclusion. thank you very much for this opportunity, and looking forward to the question and answer session as well.
Thank you, Robert. We hope that these aspirations will become a reality soon. Thank you. So one of the most important things for the elimination strategy is access to treatment. Here we have Dr. Sushil Beriwal, the Vice President, the Provider-Based Services of Varian, to share some thoughts with us. Over to you, Sushil.
Thank you, Ingrid. So you heard the previous two speakers talk about screening and early intervention. My focus from my company perspective would be to make care accessible from the therapeutic perspective. So we know that the advanced cervical cancer is predominantly treated with radiation therapy in combination with some chemotherapy. And for radiation therapy, we need both external beam radiation therapy and brachytherapy with various image guidance like CT scan, MRI, sonogram. And sometimes we use radiation therapy for post-operative treatment, even for palliation. So the challenges in providing that care is cost. One is the cost of the hardware like linear accelerator, which gives external beam, the treatment planning computers, the imaging. Other challenges are lack of trained manpower, the technician, the therapist, the physicians, the dosimetrists, the nurses. So all of those challenges makes it harder to provide optimal care for cervical cancer once they are diagnosed with locally advanced disease. So Varian as a company is an oncology company, and now recently it has become part of the Siemens. So we do provide solution at every level of cancer care, and cervical cancer being part of it. Like we do make linear accelerator, which provides external beam radiation therapy for cervical cancer. We also make technology for brachytherapy, which can deliver high dose brachytherapy. We have imaging solution for diagnosing this and staging of the disease from CT scan, MRI, and PET-CT. But more recently, we have moved to a multidisciplinary oncology solution where we are not only focusing on hardware part of the solution, but we are also focusing on the tech-enabled solution to provide optimal care, like to provide decision support tool for optimal care, which guides a physician to give the best possible care to the patient, the tumor board solutions, and more importantly, the treatment planning solution of radiation planning and delivery, which is significantly limited because of lack of manpower. And to decrease the cost of that, we have now cloud-based solution rather than hardware solution. So the treatment planning and delivery could be done from the cloud-based rather than a hardware-based solution. So these are all the resources we are providing, which will help with cancer care. And this is the work in progress to make care more accessible and available. Now, one thing does comes up, like what about specific technology for the developing country where the cervical cancer has the major detrimental effect in the outcome? But one thing we have found in our own surveys that physicians want best possible care. They don't want to compromise in the care they can deliver if they can. They want a resource which is reliable and robust, efficient, and versatile. So they don't want specific technology, but they want a technology which can strive in that environment and provide the same possible care. So appropriate utilization of existing technology is very critical. And we do have some solution in that regard with technology, which is faster, efficient, and requires less resource to operate. And you can treat more number of people because it's faster and efficient. So you can use the same technology, which we use in other part of the world, to provide cancer care for patients with cervical cancer. Optimal care, good treatment delivery, but you can treat more people. So that does brings down the cost, and you need probably less kind of expertise in terms of delivering the treatment. Now, the education and training is also part of our solution, like to provide specialized personnel, both online or on-site, provide the level of training required to make sure that even though the technology is acquired, it is used optimally, and to provide continuous education and evaluation to train new people, implement new technology, and provide certification and documentation of outcome. Because a hardware solution is only part of the solution, but comprehensive cancer solution is what we are aiming for. And in our mission for that solution, we do have some arrangement and with the developing country in Nairobi. One of the examples is the one we have to develop a sustainable oncology program in Nairobi, where we provide advanced technology, both hardware and software, which could be effective in treating cervical cancer. We provide clinical care services with hybrid model, as I was mentioning, with remote and on-site medical physics support, because one of the biggest challenges is to have medical physics which can do treatment planning. So even though they may have the technology, they may not be able to use the technology. To provide clinical support, to provide implementation training, and tech-based solution through EMR, through cloud planning and whiteboard. So all these things are important in the country where the burden for cervical cancer is the highest. So it's a multidisciplinary oncology solution, which we are working on, and we are striving on to make the cost more affordable and access more easier. We have a similar solution for planning oncology services with the university in Nigeria, where again, the cancer burden for cervical cancer is higher. So they have the hardware, but we are providing the remote planning and quality assurance to make sure the care is optimal, the treatment planning is optimal, and the approach is both, again, hybrid and cloud-based solution. So overall, the goal of the company has switched from being a hardware provider to a comprehensive cancer provider in terms of providing solution not only for delivery of treatment, but planning of treatment, follow-up of the patient, and access to the care. So with this, I would like to conclude. I would like to thank the organizer for giving the opportunity and pass on the mic to Dr. Ling.
Thank you, Sushil. We'll follow up on some of during the Q&A sessions later on. So last but not least, on a very important subject of funding to make cervical cancer elimination possible, we have with us Christopher Lim, the Chief of the Strategic Fund from the WHO Pan-American Health Organization. Over to you, Chris.
Thank you. Thanks, Yin-Lin. Thanks for including PAHO in part of this panel discussion, and good morning, evening to everyone and fellow panelists. So my name is Christopher Lim. I'm the Chief of PAHO Strategic Fund based out of Washington, DC. And I'm glad to have this opportunity to share with all of you what PAHO Strategic Fund does. And more importantly, how do we work with member states and various partners, showcasing the interprogrammatic and intersectoral collaboration in the context of Latin America and Caribbean region to bring about equitable access of essential medicines and health technologies. Now, the Strategic Fund's mission is to increase the access of quality health products that improve health outcomes in PAHO member states through solidarity, equity, and Pan-Americanism. Now, for those of you who are not familiar with the PAHO Strategic Fund, allow me to present to you the various value propositions that we have. Now, we were strongly rooted and committed to our mission statement that this is how we've been delivering upon our mission over the past 20 years. Now, first and foremost, we are uniquely poised to leverage and integrate our cross-cutting list of expertise within PAHO and working very collaborative and in an integrated manner with the vertical programs of the various therapeutic areas, both within PAHO and also with country offices to increase access of quality assured health products. Now, next is our ability to actually ensure quality, safety, efficacy standards of the medicines and supplies that we supply to member states. And this is core to our mission statement. We adhere strictly to the technical and eligibility criteria of WHO and that of the stringent regulatory authorities. And we are uniquely positioned to be able to have special waivers to import health products that correspond to the requirements of one of our 8 NRAs within the region itself. Now, through procurement mechanism, the concepts of economy of scale, where we can actually secure competitive prices for the essential medicines and health products through competitive and transparent international sourcing to get the best value for money. We also conduct continuous improvement projects to reduce any transactional and any operational related costs in a sustainable manner. Our technical units will work with disease programs from countries to align treatment protocols in accordance to that of WHO recommended treatment guidelines, and also based on rational selection and use of medicines to best suit the country's situation. Now, amongst which inevitably there will be patent-related challenges, especially for new treatments, that we will then be working with countries to evaluate their abilities to utilize mechanisms like the TRIPS and the Doha Agreement, and also collaborating with agencies like the Medicines Patent Pool. In addition, the funding also promotes and facilitates solidarity and horizontal collaboration of donations of loans between countries during times of needs. Now, the other unique feature of the strategic fund is the availability of the capitalization account, which allows member states to tap upon this pool of money as a line of credit for 60 days, interest-free, to facilitate budgetary allocation. Now, during the 55th Directing Council in 2016, a resolution was passed to galvanize member states to extend and accelerate the equitable access and rational use of high-cost medicines and health technologies. Now, in the subsequent years, progressively more high-cost medicines were made available through the Strategic Fund, including immunosuppressors in 2018, and our first biosimilars of trastuzumab in 2019, and followed by the several fixed-dose combination anti-hypertension medicines in 2021. Now, to further illustrate our interprogrammatic and intersectoral collaboration, whereby we work with different stakeholders, so other than working alongside the Ministry of Health, cancer institutions, and national regulatory agencies on the treatment protocols, updating on national formularies and deciding on what to buy, we also work with countries, right, to quantify and forecast the planning in terms of how much to buy, when to buy, and so on and so forth. Now, we also work with civil societies like UICC, St. Jude, just to name a few, to help with the advocacy of treatments. And we also work with organizations like the Medicines Patent Pool and Unite, as we've heard from Robert, on catalytic initiatives. We also work with international financial institutions like IADB and World Banks of the world, right, from a financing perspective. Now, specific to HPV and oncology, we've drawn out a couple of price illustrations of the therapeutics that is currently under the WHO Essential Medicines list, which Power Strategic Fund supports, and the price competitiveness that we actually brought to the region. Now, as you could see here, carboplatin for both the 450 meg and 150 meg presentations, some of the countries actually potentially can have more than 50% of cost savings. Now, for the more traditional docetaxel, you could see some of the countries actually can have potentially up to 90% of savings. And on top of that, in our portfolio, we do support cisplatin and paclitaxel, which is also under the WHO's recommended guidelines and essential medicines list. Now, from an IVD or in vitro diagnostic perspective, we currently have got 3 pre-qualified kits under our portfolio, as you could see here. And on this front, really the type of work that's required, right, is to understand and map out the national laboratory capabilities, the infrastructures and hardware that's already installed in country, before we can actually work programmatically, right, with the different agencies, before we can actually recommend what would be the best IVD to be used in order to optimize on existing capital investments, and then subsequently expand upon the testing and scaling out of the testing capabilities. After that, it will be requiring the quantification and consolidation across country and across the region itself. Now, a couple of challenges that we do see is one of which is the relatively short shelf life, some as short as just 6 months. And of course, the insistence of producers, right, in terms of working strictly to tier pricing, which is not our, modus operandi, our preferred modus operandi. Now, from a more acute problem standpoint, due to COVID-19, we are observing that a lot of producers are traversing their production capabilities, right, towards producing COVID-19 related products, sidelining all other disease areas. Now, also at the country level, the country authorities are reallocating resources, which ranges from financials and human resource, and also even lab testing capacities towards that of supporting COVID-19. Now, finally, we're just trying to draw parallels and from experiences of our more successful initiatives. And we would like to share with you a couple of critical success factors, right? So one of which is around the national programs. There must be a need for the nation or even for the region itself to have the political will to acknowledge specific programs, and in this case, as a cervical cancer, right, as a public health priority, so that we want to eliminate and prevent disease specifically for the country or for the region. Now, as we have seen, many of the programs that were successful, they were centrally funded and executed at the federal level rather than leaving it to be planned and executed at a decentralized manner. Now, from a capacity strengthening standpoint, with a clear national mandate that will actually allow all of us to work interprogrammatically with the authorities and the programs to help strengthen the supply chain management capabilities, especially around planning, forecasting, inventory management, and distribution. Now, as far as standardization and alignment of national treatments concerned, now the national protocols, right, will need to be aligned as much as possible towards that of the WHO recommended guidelines and that of the WHO essential medicines list. And this will ease, right, the algorithm for treatment triage, and then it will also ease the consolidation of demand and allow fast track of technical evaluation and eventually enable faster, cheaper, and more sustainable access to medicines. Now, last but not least is around market shaping and resource mobilization. And as part of our interprogrammatic work that we do with member states, it's really to understand where their resource and capability gaps are. Now, if it's financial related, we do have resources around the capitalization fund that I talked about as an interest-free loan, or we can also work with them in terms of the IFIs, the international financial institutions, for seed fundings. And if it's capacity or human resource related, we can then also be working with implementation partners, academics, to help build human resource capacity and capabilities in order to bridge those gaps. Now, as we work with WHO and also the industry in terms of market sensing and market shaping activities, especially when it comes to introduction of newer, safer, and more efficacious and more cost-effective treatments to further the mission towards disease elimination. Now, I hope within this short span of time, I've provided all of you an overview of how the mechanism that Power Strategic Fund has done in terms of integrating and leveraging of the various capabilities, both within PAHO and beyond that, from an interprogrammatic and intersectorial perspective to improve access of treatments. So over back to you, Indin.
Thank you very much. Let's move on to the question and answer time now. So thank you very much for the wealth of information and the wealth of experience that you've brought to the table, from diagnostics, treatment, innovative new strategies. So I'm going to kick off the question with Joanna first. The pandemic has really demonstrated how impressive the global response has been in terms of building up molecular testing capacity. The exponential growth for the SARS-CoV mass testing has been nothing less than impressive. And yet we have this recurring theme of cost of HPV testing, where WHO is just requiring 2 tests in a woman's lifetime. So Joanna, how do you foresee the integration of and the incorporation of HPV testing, which is a recommended test now, in the current public health response? I ask this because we only need 2 tests. I think it can be done. I think it should be done. How do you see us moving forward? Over to you, Joanna.
Thank you so much for the question. And it's a conversation not just related to HPV testing, but we are definitely having more broadly within Roche. So to just give a little bit of context about sort of the scale up that's occurred just from our perspective during the pandemic, we've provided hundreds of millions of PCR tests globally, and we've doubled our footprint in terms of systems installed. And so on the one hand, I can take your question and maybe there's a little bit of frustration, right, that we haven't been able to move HPV forward. But I think to flip it the other way, I think we need to look at this as an opportunity. What we know is as the need for SARS-CoV-2 testing goes down, there's going to be a lot of capacity, a lot of molecular capacity that has been put in place. And we need to take this as an opportunity to leverage it for HPV. I think that there's we have a fast track here to get some of this going, and I think we need to take advantage of it. I think the second piece of this that can be considered as well is as we think about how to mobilize not just those partners who are already invested in the HPV space, but more broadly public health partners who come to the table surrounding SARS-CoV-2, is there's something to be said for what happens to all of this capacity when we don't need it today, because you know what, we might need it tomorrow for the next pandemic. Unfortunately, I hate to say that, but that's a very real reality. And so thinking about how we maintain this capacity by using it for areas like HPV isn't just about HPV. It's about lab system strengthening, it's about healthcare strengthening, and it's about keeping this in place for the future so we have it there based on what the needs are.
Thank you. I actually see the silver lining because it's easier to have these conversations with stakeholders now. You hear from policymakers, they understand what CT values are, and so the conversations have been easier. Now, with any screening, of course, we have to think about treatment. So I'm going to move on to the next question, and it's over to you, actually, Robert. This question is to you. So there's no doubt that cervical cancer affects the most vulnerable populations, just as HIV, TB, and malaria. The coordinated approach in addressing these infectious diseases have been commendable. What can we learn from those lessons? One of the game changers as a gynecologist is the treatment of pre-malignant diseases with thermal ablation, which we've highlighted. It fits the bill of practicality, cost, and effectiveness. I think we're not using this and we're not picking up the technology quick enough. Why do you think that's the case? And what can we do about it?
Great, thank you, Ling. Two very important questions. Addressing the first one, what we can learn from the global response to HIV and TB, for example, and how might those lessons apply to the efforts to eliminate cervical cancer. I think firstly, we need to remember that we had similar challenges for HIV, for example, in the 80s and 90s, when it became visibly massive public health problem. And there were no concerted efforts to address the issue in LMICs. And it only took us until early 2000s before we started to see a commendable global effort coordinated to address that. To eliminate cervical cancer, we're going to need the same level of global coordination across all sectors, state and non-state actors. We're going to need consistent advocacy to achieve the political, financial, and social commitments that are required to address this issue and to eliminate cervical cancer, and at all levels, including the critical role of civil society on the ground. And then secondly, in that regard, we've learned quickly that it was not possible to separate HIV and TB interventions completely in the response. So similarly, integrated approaches to working to eliminate cervical cancer will be really important. When we talk about the delivery models, when we talk about the health technologies like the screening technologies and platforms, when we talk about the approaches on the ground to generate demand and awareness, we need to do this in an integrated way. It's not about a vertical approach to eliminating cervical cancer. And then to your second question around the slow uptake of thermal ablation, I fully agree with you that this game-changing approach to ablating precancerous lesions needs to be scaled and much more rapidly than we're seeing today. And if we don't find a way to generate further demand for these devices, which are handheld, they can be deployed at the point of care, the training required is not significant, we're gonna see these companies exit from the market, and it's taken a lot of effort to get them into the market with the 50% price reduction we spoke about. So two important things here, I think. Technical assistance must be a part of what we do to work with lower middle income countries and their partners to ensure that they see where these approaches to preventive therapy can fit within the overall response, but also demand generation and demand creation for this type of therapy in the context of a holistic package of cervical cancer services is going to be needed. And linked to all of that, obviously, sufficient financing so that we can scale the rollout of this really important preventive therapy once we've generated demand for it with governments, but also with the beneficiaries and the healthcare providers for the intervention. Let me stop there. Two really important questions. Thank you.
Yeah, I do think there's still a reluctance on the physician side to sort of brave and cross the bridge when it comes to using thermal ablation. And I certainly hope that we will take that bold step forward. So, you know, one of the big things in LMIC then is the access to treatment, Sushil. It is said, Sushil, that technology must be built and designed around humanity. Radiotherapy services is central in the treatment of advanced cancer. But on the other hand, these cancers affect populations where healthcare facilities such as logistics, electricity, and amenities may not be available. In fact, 9 out of 10 individuals who need radiotherapy don't have access to them. Moving forward, how do you extend sustainable treatment programs in terms of securing financing and manpower to execute a lean and cost-effective service when other infrastructures are lacking? Are there any models that you're aware of that you can share with us?
Thank you for the question. I know you bring up a very important point that the countries where the cervical cancer burden is the highest have the least access to the treatment. And that is impacted not only healthcare, but economic impact. So I think some of the solution could come from like state and private partnership. Like, as you are aware that, like, if you look at the healthcare model of treating cervical cancer in developing country, they all show that there is significant positive impact on economy. So what we spend today in healthcare for treating cervical cancer could translate into a significant positive impact in overall health of the country. So the state partners need to understand that, you know, the investment in the treatment may look capital intense, but in the long run, that capital is very small part of the total gain which we'll get by treating patients with cervical cancer, bringing them to the workforce, making them healthier, and helping it out. So some of it could be from the partnership, and we do have some partnership in, like as I showed with the university in Nigeria, to bring it up to the speed. The second part, yes, the manpower issue is also a significant problem. And some of the solutions we are working on will come through AI, artificial intelligence, where segmentation, treatment planning, rapid plan, all of those will condense the amount of manpower needed to implement the treatment. So I think those are work in progress. Some of them are being used, but some of them need to be more honed, and we have to improve upon that. Then some of the other solution we talked about is cloud-based solution, which may solve some of the power issues, some of the infrastructure issue in terms of providing the solution. So there are cloud-based solutions which have come up, which can provide treatment planning, which can help with remote support, which can help with education, which can help with guidance. So I think that things are in progress, but we are not there yet. A lot more work has to be done, but we are making progress, and we are making small and steady steps, not at the pace we would like to do. But that being said, a lot of solutions are in the pipeline, which will help provide better access to treatment delivery in the country where we need the most. Thank you.
Thank you. So aspirational on my part, I hope that we will be able to shift that to more women having earlier diagnosis and earlier treatment, so that we can use the limited radiotherapy services for other cancers that we cannot eliminate. So, you know, all this really comes down to the dollar. So, Chris, the last question I would like to ask you, you've really shared with us an impressive roadmap of the PAHO Strategic Fund. To what extent do you see other regions replicating this? What do you say are the initial critical steps to be taken, for example, in Wipro? So you've really drawn out a really nice roadmap, but what are the barriers in achieving that?
Thanks, Lin, for the question. Right, in fact, it's pretty timely because really just as of the last 2 weeks itself, I've been receiving very much similar questions from both Africa and folks from or our partners from Asia as well, wanting us to share now what have we been doing and how have we been been able to keep this sustainable, right, in a sense. So I would say that first and foremost, I think a lot of this cannot be achieved overnight. That's for sure. And just to see, just to share some of the history that you probably have seen, right? A lot of this work that we've done has really been a cumulative efforts, right, from over the past 40 years, really in the Latin American region. And I'll say one of the biggest critical success factor for us, right, is really this word called solidarity. And for this entire thing to work, and it has been working very successfully, at least within the Latin American region itself, is this combination of solidarity, Pan-Americanism, and really this consolidated one, right, to eliminate a specific disease area and so-called reach equity, right, for members of the region itself. And for that to happen, it really means that even the bigger countries, right, they need to really scale down in terms of their bilateral agreements. Well, because the very fact that they are bigger countries, they have probably a lot more bargaining power. They could actually draw down upon their bilateral agreements and move away from this funds like or mechanisms like the strategic fund itself, right? So this solidarity really needs to work, and for the other regions to actually have this similar achievement, right? They really need to come together and have this consolidated one. So I think that's the first and foremost, right? And beyond that is, I think pool procurement by itself can only bring you so far in terms of leveraging of economies of scale and all. I think the other success factors for us is the fact that we have provided, or rather we are integrating, right, a number of other important services, like, for example, capacity building around supply chain management, around quality assurance, quality governance. So we are actually working very, very closely alongside the ministries, right, in terms of understanding where their capability gaps are, as I've explained earlier on, and then work with them, right, programmatically, right, to increase those capacities. So we are not just bringing about economy of scale, but at the same time making sure that the capabilities and capacities are being upgraded along the way, so that the entire effort can be sustainable. So again, just to summarize, it's definitely not something that can be achieved overnight, and it requires a lot of political will, and of course collaboration across multi-sectorial departments and authorities to make this a success. But very good and timely question. Over back to you, Yin-Lin.
Thank you. I really like those concepts of consolidated one and solidarity. And I genuinely and sincerely believe that such conversations with industry, with non-governmental agencies, it's going to accelerate the cervical elimination goal if we keep these conversations going. So I hope these conversations won't end here today, and that we will continue to bring it to a higher level. So thank you very much, everyone, and thank you for your time.